Hey guys, what is up? It's your girl Ozzy and Shy here, back with another video. And today we'll be talking about the chemistry of organs. Our subtopics today are liver, kidney, stomach, heart, and lungs. Now our first subtopic today is the heart. The past is the first heart transplant was done on December 3rd, 1967. This was done on a 53-year-old man named Louis Washington at Groote Schuur Hospital in Cape Town, South Africa. The future is the Human Heart Project has created a way to stimulate a basic heartbeat in less than 2 hours. A variety of treatment plans can be evaluated through the process. The stimulation can first figure out how your heart changed after you have a heart attack, but can be prevented entirely. This is believed to evaluate real patients by early next year. Some wow factors are: the heart is a muscular organ that pumps blood throughout your body. Damage to the heart vessels can cause the heart to work harder. Heart attacks are more likely to happen on a Monday. The heart attack is about 10 to 12 ounces. The heart pumps about 6/4 of blood throughout the body, beats 60 to 80 times per minute.
She's having a heart attack. Dr. Justin to the rescue. Clear!
Now our second subtopic today is lungs. The past is Dr. James Tardy performed the first human lung transplant in 1963 in Jackson, Mississippi. The first double lung transplant for emphysema was done in 1986. Immunotherapy is for patients with lung cancer. This theory activates a part of the patient's immune system to fight the cancer. This helps stop or slow the growth of cancer cells and keeps the cancer from spreading. The theory involves a protein that normally suppresses the function of T lymphocytes, which can kill other cells, including tumor cells. Some wow factors are: the lungs are a pair of air-filled organs located on either side of the chest. The windpipe conducts inhaled air into the lungs through its tubular branches called bronchi. The lungs are covered by a thin tissue layer called the pleura. People with lung conditions can develop the following: chronic obstructive pulmonary disease, pneumonia, pulmonary fibrosis, obesity, and lung cancer. Lungs aren't the same size. They can float on water. Oxygen only plays a small part in breathing. Someone usually breathes an average of 6 quarts of air every minute. Now our third subtopic today is liver. The past is the first human liver transplant was performed by Thomas Starr in 1963. The next 2 decades were marked by difficulties with the donor organ quality, recipient selection, operative perioperative management, immunosuppression, and infectious complications. Now the future is patients with cirrhosis are likely to be treated simultaneously with a targeted anti-inflammatory agent, an agent to lower pressure with an anti-fibrotic or fibrotic agent, and effectiveness of the treatment may well be monitored by using a panel of Sermon market. The development of effective targeted treatment and the tools to monitor the effectiveness non-invasive will change the way we view and treat cirrhosis. Some wow factors are: the liver cleans out your blood. They produce an important digestive liquid called bile. They store energy in the form of a sugar called glycogen. The liver has at least 500 distinct functions in the body. It's an organ that is also a gland, creating important chemicals for many processes. The liver stores vitamins and minerals, which are vitamin A, E, and K, which are fat-soluble vitamins. Liver donors provide part of the liver to a recipient. The liver of both the donor and recipient grow back to full size approximately 3 months after surgery. Our fourth subtopic today is the stomach. The past is William Beaumont was the one who discovered the working of the stomach. The stomach pump was invented in 1767 by a Scottish physician named Alexander Monroe. This didn't gain popularity until the early 19th century when Dr. Philip Surgeon, a physician who independently discovered the stomach pump to treat children who were very ill. Now the future is bariatric surgery changes your digestive system to help you lose weight. Gastric bypass surgery is a surgical procedure in which the stomach is divided into a smaller pouch and a lower remnant pouch. Robotic gastric bypass is beginning to be done by robots for a more accurate procedure. Some wow factors are: the stomach acts as a place of storage for the food one eats, acts as an acid to the digestive process. Food is turned into a semi-liquid substance. so the nutrients can be absorbed. The stomach also is used as a destruction of contaminants that the other foods may contain, such as bacteria and other microorganisms. I'm sure you're all wondering exactly just how the food leaves the body, so let me tell you. After a few hours in the stomach, the new liquidized food is pushed downward through another veil called pylorus, then to the small intestine. Here the chemicals are added to neutralize stomach acid. Enzymes from the pancreas and bile from the liver are secreted to further the digestive process and break down fats, carbs, and proteins. The more you eat increases the amount of acid in your stomach. There's always acid in your stomach. The stomach itself is made of protein, and unless it's protected, it would be consumed by the acid. The stomach is protected by a layer of mucus.
Ozzy, I need a kidney.
I don't know what to do.
I do. You can give her yours. You only need one kidney to survive.
Now our fifth subtopic today is kidneys. The past is Dr. William Kolff constructed the first artificial kidney in 1943. By the 1950s, Kolff's invention of this solved the problem of acute renal failure. The first kidney transplant was done in 1954. In the 1962, Scribner started the first world's outpatient dialysis facility. Future is there has been new ideas forming to increase the rate of kidney transplants. For example, increasing communication and publicity design to draw the public's attention to the idea of giving to another in the form of a needed kidney. Providing public education to let others learn about the value of preemptive kidney transplant. Lastly, adopting important programs for willing to donate an organ after death. We've been seeing a lot of activity in the development of STEM-based strategies to build new tissue for newly built kidneys. Some wow factors are your kidneys are two of the most important organs in your body. They filter your blood of food in the body, they change your blood pressure, they help in making red blood cells, they produce active vitamin D. Kidneys are small, about the size of a cell phone. The condition called renal agenesis is when a person is born with only one kidney. Now our first job is an organ import coordinator is responsible for the evaluation and communication of important organ offers. In order to become one, you need an associate and bachelor's degree, along with job experience in medical field. They make $25,000 to $69,000 per year. Now our second job today is a tissue recovery technician uses surgical instruments to recover tissue from a deceased donor body during a tissue recovery case. In order to become one, you need good knowledge of human anatomy function and basic medical terminology. They make $60,000 per year. A physician assistant organ transplant provides expert management across the 4 stages of transplant core. In order to become one, you must have an active or an eligible to obtain a New York license. They make $98,000 per year. Now our fourth job today is a kidney pancreas transplant coordinator. Is responsible for the critical case management of transplant recipient involving all phases of a transplant progress. In order to become one, you have to be graduated from an accredited nursing program with a BSN or MSN and 5 years of relevant RN experience with a combination of critical care and transplant experience. They make $420,000 to $35,000 a year. Now our fifth job today is a perfusionist, is in charge of routine patient care that is under the direction of the director in cardiac surgery. In order to become one, you need a bachelor's degree in medical or science field. They make $115,000 to $140 per year. Now our sixth job today is an organ referral preservation coordinator. Referral responder is responsible for responding to heart-beating ventilated referrals, ascending organ donor suitability, and enhancing the donation progress. In order to become one, you need 1 year experience in the medical field, medical terminology, or new graduate RN. They make $79,000 per year. An organ surgeon is responsible for coordinating the procurement, surgical staff with the clinical recovery, preservation, and transportation of organs to be used in clinical research. In order to become one, you need 4 years of undergrad RN. They make $79,000 a year. Now for our eighth job, a paramedic organ procurement coordinator is responsible for donor evaluation and management at hospitals with care service area. In order to become one, you need ICU and 3D experience. They make $46,000 to $93,000 a year. Now for our nice job, an organ transplant coordinator is an encompassing specialist nursing care focused on protection, promotion, and optimization of the health and abilities of patients awaiting transplantation, as well as transplant recipients. In order to become one, you need a certified clinical transplant coordinator within 24 months of employment and must complete continuing education requirement to obtain CCTC. They make $73,000 per year. A director of organ procurement is responsible for all matters related to the recovery of organs for transportation. They make $46,000 to $93,000 per year. Okay guys, thanks for watching. I hope you enjoyed our video. Don't forget to like, subscribe, and comment down below your opinions. Thanks for watching. Bye!